So today's topic is strategies for successful family medicine practice. It will be an interactive session, and through this, we will try to give you some practical information as well as discuss a lot of philosophical things and have fun. So, going ahead with the session. This is what we are going to discuss today in this session. We'll have some introductions. We'll discuss the 4 stages of family practice, and we'll give you 5 strategies for each stage. And finally, the secret ingredient of family practice. And lastly, we'll have question and answer as far as the time permits. So since this will be an interactive session, let's start with a bit of getting to know our participants. So which city are you joining from? Please share in the chat box. We have someone from Gurgaon, Delhi, Chennai, Raipur, Bangalore, Udaipur, Great Mumbai, Vizag, Patna, Trivandrum, Mathura, Patna, Pori. Okay, Hyderabad, great. A mix of big cities as well as small cities. Anyone from rural background, from a small town or a village city? Okay, good. Devashish, all right, great. So we have pretty much all corners of India represented. So that's great to hear. Now, I think everyone is chatting to hosts and panelists, so probably you cannot see each other's responses. So for the next question, please change this setting to everyone. In your chat box, you can see this blue button which says hosts and panelists. Click on it and change it to everyone so that everyone can see your responses. Dr. Rekha, yes, the recording will be available later. It's been recorded. Not so much from Nagpur, Dr. Swati, welcome. All right, great. Yes, Dr. Gaurav from Mumbai. Next question. How old are you? Okay, 30, 26, 34. Sorry, ladies, to have asked this question, but I hope you will be truthful about your age, at least because of the medical sessions. So we have a couple of you in 20s, mostly in 30s and 40s, and some of you in 50s also. Okay, thanks so much. So we know this is a pretty young crowd. A lot of passion, I'm sure. So what is your specialty? That's the next question. But what is when someone asks you a very common question, right? You are going in a train and you tell your co-passenger, I'm a doctor. Okay, doctor, what is your specialty? So what do you tell them? MBBS, okay, DMD family medicine. But MBBS is not a specialty. What do you tell people when they ask you your specialty? Community medicine, maybe a general physician, family physician, critical care, family medicine specialist, physician because they don't understand family physician. That's a good point. General practitioner, that's another common answer. I use equally family physician and general practitioner when someone asks me this question. General practitioner. All right. So most of us are in general practice and family medicine. And probably that's dictated by the topic. So probably other specialties they didn't join. And that's fine, right? We have fun as family physician GPs in this group, in this session. It's GP and family medicine. Probably go just and because family medicine is a specialty and it's not a specialty. It's a specialty in the sense we do special things which no one else is doing. But we are generalists. We are not focused on an organ system or a kind of a patient or kind of a disease. We are generalists. Okay, now we dive into some more philosophical questions. This session is all about success. So, what is your definition of success? What do you think it means to be successful? Respect from everyone. Very interesting. I'm happy to have that as the first answer. To be satisfied at the end of the day. Okay, money. Thank you for being candid about it. Yes. Healthy patients, wealthy practices. Interesting. Content. Yes. At the end of the day, if you're content that you've done the right thing, satisfied.
So sorry to interrupt in between. The voice is coming a bit low.
Okay. Try this. Is this better now?
Still it's on a lower note, sir.
Okay, is this better now? How about now? Is it better now?
Yeah. Well, go ahead, sir. Still a bit on a lower note.
I try to be louder, I guess.
Sure, sure, sir.
Okay, so we have money, respect, good lifestyle, peace of mind. That's not one word, but thank you to tell us that yes, success is not one-dimensional. Fruitful life, balanced practice and the timings. We have a large base of patients to attend, okay, and be able to make a difference in their life. Trying to make a change, positive change in our patients' life. And we end with respect. Great. Right. So on one side is this society thing of being successful is about the greatest and the greatest gadget and biggest cars and biggest bungalows. And on the other side, there is this attitude that I think everybody should get rich and famous and do everything they ever dreamed of so that they can see that it is not the answer. So money is not everything. So I think the balance lies somewhere in between, that money and other things are all important, and money can be as a means of attaining the other things. So I like this concept called ikigai. It's a Japanese concept. And if I was to give one word to a definition of success, I would say it's ikigai. If you have attained ikigai, you're successful. What is that? It says that if you have this combination of these four aspects, what the world needs, what you can get paid for, what you're good at, and what you love. If you can find a balance of all of these things, then you have attained ikigai. Now they are interlinked. Right? So where the world needs, also what the world would be willing to pay for. And what you're good at, generally, you start loving that. And what you love, you practice it more, so you become good and good at it. So let me put it this way. So for a doctor, for an MBBS doctor, opening a family practice clinic is one of the best ways of attaining impact, of becoming successful in all aspects. And because most of you are practicing family physicians, I guess you will agree with me. So it's what the world needs, and it's what we can get paid for, depending on the area, of course. I know how much we get paid for the consultation, but yes, you can get paid for it. And if you're in private practice, whatever efforts we put is equal to whatever money we get at the end of the day. And we can get good at it by practicing, and grow to love it. If we don't already love it, there is so much of good in family practice that we end up loving it. So much of respect we get from patients, so much of variety is there, so much of difference we can make in people's lives, and all the things that you pointed out in the chat. So all of that we can achieve in our private family practice. So with that, let's start on the practical aspects of getting to the strategies of a successful family practice. So there are 4 stages in a family practice: the idea stage, opening stage, the growth stage, and the mature stage. Idea stage is when you're just thinking about it, you haven't opened it yet, and you have a lot of doubts in your mind and a lot of things, concerns, fears, but a lot of excitement also. What should I do? And all the ideas floating around. Um, then when you open it, uh, you have started, you have taken a place, you have opened your clinic, and later on the patients have started coming in, you are growing. And then at the maturity stage, you have an established practice, what we call it. The patients keep coming in, they have become your fans, they have become your family, and in the whole community, they have become part of the community. So now back to you. What stage is your practice at? Can you share in the chat box? Is it idea stage, opening stage, growth stage, or mature stage? Okay. A lot of people in idea stage, just doing their training. The Vivek is between idea and opening. Okay. Most of you are in idea stage, thinking about joining. His practice is 5 years old, so somewhere probably in growth stage, hopefully. Dr. Vikram is 6 years old. So what do you think? Are you in growth stage or mature stage? Growth stage, 1 week. All right. No question. Great. So most of you are in early stages, so we'll spend more time in the early stages. And I think doctors who have the growth stage or mature stage practice, they can probably join me in giving you advice as well. So please chime in and put in your ideas also in the chat box, Dr. Vikram and Dr. Aarti, please. All right, so let's start with the first stage, which is the idea stage. So first strategy I would suggest for everyone in the idea stage is to start early. A lot of doctors ask me, sir, what is the right time to start it? What all things I need to do before starting? And I tell them this right now, today is the right time to start it. Okay. If you are doing your training, then immediately after your training finishes, that's the right time to start your practice. Even if you don't do any family medicine particular degree or diploma, right after internship is the right time to start it. And the reason is this. In our training, healthcare training, there is, in our healthcare training, there is not much exposure to, there's not much exposure to family practice. All we see is big specialists, tertiary care hospitals we get our training in, and we don't get any exposure to private family practice. So the only way to get exposure is to start early and start learning. Because this training will not happen in tertiary care medical colleges. Unfortunately, they will teach you the specialist way of looking at things. There's nothing wrong in that, but they cannot teach you the generalist way of looking at things because they do not know that generalist way. So that you develop when you yourself start becoming and seeing patients independently. So Dr. Dilip, I agree that SIHIP gives you exposure. Yes. When you go with the right mindset to a hospital, okay, this is what I'm going to learn. Then you of course end up learning good things. But it's about the attitude. So the more time you spend in a hospital, in a tertiary care setting especially, the more it is drilled down into you that your plain MBBS degree is not worth anything, or even family medicine degree is not worth anything. You should have become a specialist. So what I suggest is start early and learn as you go, and we'll just come to that. So you have a lot of concerns in your mind, but a ship in harbor is safe, but that is not what ships are built. for sailing, exploring the unknown, and braving the storms, and still coming ahead. So the next strategy is to find and follow a mentor. So a mentor would be a practicing family physician who has an established practice and who, and if you contact any such doctor, they will be happy to have you come in as an observer or to see their practice, help out in whatever way. And there is where you learn what it is to start and maintain a family practice. So you find and follow a mentor. And it is at that mentor that all of these concerns one by one will start melting away. So one of the common concerns I get is I'm not confident in dealing with emergencies. So when you attend a family physician's clinic, you will see that emergencies are very, very rare in a family practice. And actually in the metro cities, people with emergencies do not come to family clinics. They know to go to the tertiary care hospital, and there are a lot of tertiary care hospitals in metro cities. So it's rare that you would ever see an emergency in your clinic. So you need to be more confident about managing the day-to-day illnesses, the low intensity, the mild illnesses that people have on a more regular basis. Emergencies, you will rarely see. And that and other concerns, the mentor will help you to gradually mentor. We do have a mentorship program. So if any of you are interested, I have my number and the email on the back. So you are welcome to follow. And MBBS graduates or with family medicine degree or without family medicine degree, all are welcome. And we'll discuss all of this in detail. All right. Next strategy is to make sure that you have alternative sources of income. So alternative sources of income means that in initial stages, your practice will not generate enough revenue to provide you with a good enough income, and that gradually builds up. So somewhere around 6 months is when you will stop to you won't need to put any more money from your side into maintaining your clinic. And around 1.5 to 2 years is when you start getting enough income to compare with any other job that you have. So on an average, I recommend that for the first 2 years, you will make sure you have an alternative source of income. For example, it could be that husband and wife, one of you is working and one of you is starting the clinic. It could be that you're doing a RMO job in a hospital and then part-time you have started your clinic. And as the practice builds up, you can reduce the number of duties that you take. It could be family support. If you're fortunate to have a family that can support you, then that could be another source of income, or rental income and other kinds of income. I will have the number on a slide at the end of the session and my email as well. Choose a visible spot for your practice. That's the next strategy. Initial days, who will come to your practice is people who are just walking around in a market area, and they see, okay, there is this new doctor that has come up. Oh, I remember I have this mild pain, nagging pain in my back. Let me just see what this doctor says about it. So you will get a lot of walk-ins. Okay. Visible spot also means that it should be in the vicinity of other established practices or pharmacies and labs, diagnostic centers. So the patients who are visiting those and may be unsatisfied with those services, they will also be coming to your practice. And lastly, there is this category of hypochondriacs. So patients who can never be happy with their doctor that they see because they have so many complaints. But you, in the initial stages, will be in a perfect stage of helping them because you have lots of time and you can listen to each of their complaints one by one and discuss them in detail. And sometimes those patients become the word of mouth that will grow your practice. So choose a visible spot for your practice and start small. So we are fortunate in family medicine to have be able to start with a very small investment in extreme kind of sense. You only need a table, chair, and a stethoscope and some writing pad to start the practice. But this is one of the chamber of one of our clinics, which has I start always with a EMR, so electronic medical record. My laptop is there, some torch and stethoscope and a hand sanitizer and a printer and a X-ray viewing box. So we can start with very minimal setup. If you see, the look and feel is good enough, but it's not extravagant. The chair and is comfortable, but not very expensive and very comfortable. Our ticket size is small, so each patient gives us a small amount of money, and initial stages the numbers need to take time to build up. So the setup cost should ideally be low, so that we don't get into the rat race of where should I get the patients from, where should I hunt the patients from, and where should I capture the patients. We should not get into that rat race. So we should be able to be satisfied with whatever numbers are coming in and be able to provide the best care possible, and that will form the nucleus on which the rest of the practice lies. So these are the 5 strategies for idea stage. Start early as possible. Right now, start it. And to start it, find and follow a mentor who can take care of all your doubts. Make sure you have alternative sources of income for the first 2 years. Choose a visible spot to start your clinic, your practice, and start small. And of course, in the next stage, we will gradually build it up, but start small. So in summary, just do it. Okay, now another question has come: which institute to join to get good exposure for learning family medicine? So the point is, you do not join an institute to get good exposure for learning family medicine. You start your clinic and get good practice by seeing patients. And you can join a mentor and follow a mentor who is practicing family physician to discuss patients or to discuss practice scenario. Now we come to opening stage, and this is also an exciting time. So many different things are happening. You're negotiating different things. You are thinking of what kind of furniture to get, and you've already got it. And what are marketing strategies to do? You're getting a lot of advice on that front. So here are the strategies. So number 1 is good communication skills. This is the behavior of the doctor that makes sure that the patient is comfortable and they are giving good history and comfortable for the examination, and they are receptive towards what the doctor has to tell them. So the compliance is also better. There are lots of books and lots of sessions can be done on communication skills. The one thing that you can do is the golden minute. Now, what is the golden minute is, in general, whenever the patient starts speaking, doctors have a tendency to interrupt. And because we want to know, okay, the patient says, I am having fever. Okay, how long have you had this fever? Is this fever high grade or low grade? Are you getting chills? And is this a everyday fever, or is it like an alternate day fever? So we have so many questions, and we have been trained to think of these questions after hearing the chief complaint and ask these questions. But that actually becomes a negative. In the initial stages, if we give the patient time to tell the story in their own words, that helps to build a rapport. That helps to build get the patient more comfortable and develops that bond. I mean, we only have a few seconds to impress any new person that we meet, and if we are receptively listening and encouraging the patient to tell more and more in their own words, their own story about what is happening to them, that is the golden minute in which we have that power to get that rapport going with the patient. And that will help in the whole consultation and beyond that. So remember this one thing, golden minute. Second strategy is the availability. So initial stages, when you're opening stage, you're competing with maybe other specialists or other general physicians who are there in the area. And if they have their established practice, most likely they would not be seeing patients on holidays, weekends, evenings. So that's a low-hanging fruit because a lot of urgent patients would want to see a doctor right there and then. Okay, so if you are available on holidays, weekends, and evenings, and if you're young, as most of you are, it should be easier to be available on holidays, weekends, and evenings. Then those initial few patients, urgent patients who come to you, can form the nucleus on which the practice grows future. Also, make sure that you are available on the internet in both ways. This teleconsultations are also one of the ways to start seeing patients and developing your confidence, communication skills, and you can start doing that. There are some teleconsultation platforms that you can join. Also, in internet, make sure that your clinic practice is visible on Google. Because a lot of patients are now starting to search for doctors. So there's a doctor near me, there's a physician near me, and if your name shows up close enough, and if you're available when they're searching for you, then they will join in. Now we come to the learning part again. So some learning we got from the mentor, but all the learning, I would say 90% of the learning that I got was from learning as I saw the patients. So the learning will start when you start seeing patients. It will not happen before you start seeing patients. If you keep waiting for that, that's only 10% of what you need to know for your general practice. That's actually when you start seeing patients, that's when you start learning new things. And there is this strategy called funds equals dense. What that means is the patient's unmet needs is equal to the doctor's educational needs. So when you start seeing patients, if you come across any unmet need of the patient said something, said a chief complaint or has a disease or is taking a medicine or there's a lab test that has come and you don't know about it. So after the patient has left, you note it down in a diary or in your mobile in a notepad. And that is the patient's unmet need because you were not able to satisfy the patient's need in this visit. And therefore, it is your educational need. So when we do this, that gives us a lot of motivation incentive to pull up a book, pull up a Medscape or up to date or search on the net or PubMed and find the right resource to answer this question. Otherwise, family medicine is so vast that it gets overwhelming to try to get all the knowledge possible before starting to see patients. And that's not necessary also. This is a more effective way of learning as you see patients, because this learning will stay in you, in your heart, mind, and hands for a long, long, long time. Yeah. So let's see two examples. So what's this? What does this patient on the left have? The first picture. And type your answer in the chat box. Some of you are saying herpes, some of you are saying herpes zoster, shingles. Right. So shingles is the right answer, which is herpes zoster. Herpes alone may not be the right answer because herpes simplex is a different disease. This is not herpes simplex, and treatment may be similar, but we have to make sure that we have the right term, which is the herpes zoster shingles. Right, great. But if you see something like this or a different kind of a rash, and you are at a loss as to what it is, just type the description into Google, and a lot of times you will get good resources on the net. They will tell you, okay, vesicular eruptions on the hands that is in child children, for example, could be hand and foot disease. Right, and the second one, Dr. Arti has already answered. What is this? What are these people doing? In the diagram on the right. 6 or 5 plays. Maneuver. Right. So this is the Applies maneuver. So patient who comes with vertigo, you do this procedure and they say, wow, I feel so much better, doctor. You have magic touch. You have made me feel so much better. So these are the kind of things you keep learning and making sure that you keep going and practice-based learning is the best because it stays with you for a long time. Next strategy, always a very good history and examination. So you have the time. There is no excuse not to take a good history and examination and note it down in your prescription or in a note or in an EMR. Note down everything that you have asked in the history and examination. Because these notes will again form the nucleus in which you can build up your learnings. So as you think about all these patients that I saw, did I do the enough things for them or not? You can go through the notes and rethink. Actually, with this good history and examination that you did and note it down, or think of other things that you could have asked or you could have done in examination, lab tests you could have asked for, and explanations you could have given the patients. But the starting point is if you can do all of this only if you take a good history and examination for every patient. And you have the time in the opening stage to do that. And if you make this a habit in the opening stage, that stays with you in the long run also. But if you start taking shortcuts right now, then that's what the habit remains in the long run. So always a good history and examination right now in the opening stage so that it becomes a habit. And it's okay if you don't get to the diagnosis because it's okay to cure sometimes, but we can always relieve of it and we can comfort others. Right. And now the biggest strategy on the business front is add additional services one by one.